Well, and a very good afternoon and welcome from KTN Newsdesk. And this particular afternoon we'll be covering for you the latest stories, one of them including that strike by the doctors across the country. And we have our reporters that are standing by across the country. But first, let's start you off with the highlights.
Patients' agony as the nationwide medical workers' strike begins. And several Kenya Airways flights are cancelled as technicians also go on strike. The dilemma of evicted squatters in Kisauni. And in Brazil, thousands of protesters demonstrate against corruption in Rio de Janeiro.
Good afternoon and welcome to the broadcast. And we want to tell you some of the stories we are taking up this afternoon, that being the ongoing strike by doctors. We have our reporters covering this story for you, and we have Caroline B, who is at our City Center studios, and we also have Victor Gale, who will be giving us an update from Nakuru County, and also we have Elvis Kosgei, who is standing by in Eldoret, where we'll be getting the latest regarding the effects of this doctor strike. And let's start you off on that note. And doctors and nurses have begun a nationwide strike after talks called by the Ministry of Health collapsed yesterday. In an earlier press conference on Sunday night, Health Cabinet Secretary Cleofa Mailu said the ministry had been scheduled to meet union, who allegedly did not show up. Meanwhile, a major operation has been launched as more than 100 mental patients escaped from Mathare Mental Hospital in Nairobi due to the ongoing doctors and nurses strike. Nurses serving in public hospitals have also downed their tools to press for various demands, as we have been updating you in earlier bulletins. Now get you some of these other stories. And well, nurses serving in public hospitals have also downed their tools, and our reporter Caroline B is keeping tabs on developments with the nurses strike. Let's catch up with the very latest. And Caroline, so far, how has the strike panned out in terms of, we did see the talks happen yesterday. Is the strike still on?
Well, the strike by the nurses is still on, according to a briefing this morning by the Kenya National Union of Nurses Secretary General Seth Panyako. They will not call off the strike, not until the government actually gives a commitment to tell the nurses that the Treasury has money to be able to implement the CBA that was signed, or that they are actually pushing for, which dates back to September of 2013. Well, they also want SRC to have the CBA signed, and also the papers are going to be presented to court, and it's not until that moment is when they are actually going to go back to work, but not until negotiations are done as per the CBA that they are demanding for harmonization of allowances from various levels of health workers, from those who are absorbed by the local government to the transitional counties as well, is what they want, the harmonization of that. They also want workers to be in better terms in working, especially for the counties. And it's not until the CBA is harmonized is when they will actually go to work.
And perhaps, Caroline, looking at this state of affairs, a number of the hospitals have also seen patients actually being put to wait, no one to attend to them. Have you been able to visit one or two of these hospitals?
Well, a quick check as of this morning, when I actually talked to some of my colleagues, is that the Kenyatta National Hospital services was still ongoing. Well, they said they're going to issue a statement much later concerning that, but the doctors and the nurses who are currently on strike had actually threatened to go to that place and, demand for the rest of the doctors to also continue with the strike. But a check at Mbagathi Hospital and Mama Lucy Hospital, while services have been paralyzed, patients are not able to access services. Some of them have even not been able to go to those hospitals. So that is just a check at the Mbagathi Hospital, Mama Lucy, and Kenyatta National Hospital, where services are still ongoing.
Well, many thanks, Caroline B, our reporter, just following for us this developing strike. that has continued to paralyze operations at major hospitals across the country. And in Eldoret, operations at the Moi Teaching and Referral Hospital have come to a halt in the ongoing strike. Here's our reporter Elvis Koskei with more. Good afternoon, Elvis. Just paint for us a picture of what is the state of affairs in Eldoret County.
Thank you very much. I'm here at Eldoret Referral Hospital, where patients are really suffering because of the doctor's strike. We have about more than 30 patients who are here just waiting for doctors or just waiting to get service from the Moi Teaching and Referral Hospital. Earlier on, we had spoken to the doctors, and they say that they will not relent on the issue that surround the doctor strike, despite the injunction from the Council of Governors, where they say that this strike was uncalled for, but doctors have remained steadfast, and they're saying they'd continue with the strike till the government hits to their demand. I'll just speak to one of the patients who is here at Moi Teaching and Referral Hospital, just to paint a picture of what is really happening inside there. We are told that doctors are not inside at the moment. Did you get any service from the doctors?
I haven't got any service. I have been here since 7 in the morning. I've been waiting for the doctors, but I've never seen even a single one. I've not even got any assistance from the doctors. Yeah.
Okay. What is the problem?
I don't know. They told us that they were at a meeting. We are still waiting for them, but we haven't seen them coming to assist us.
Okay, we have been assured by the CEO of Moi Teaching and Referral Hospital in Eldoret. I said that everything is okay here in the hospital, though we have not been allowed to enter inside. They have told us there are nurses and doctors attending to patients. Is that in order?
I think there is nothing going on because I myself, I've been waiting since morning, but I have not even been assisted by anybody.
Seriously?
Yeah.
Okay, let me talk to one of the also patients who are here. What is the situation inside there?
The situation is pathetic. I've just brought a patient, and no one is attending. The patient is in pains, and I don't know who will help. I'm urging the government to intervene in this case because people are suffering. Some are dying. The situation is very bad, very bad. I'm really requesting the government to assist the people of Kenya because they have the money. Why don't they negotiate with the doctors and save the situation in Moi Teaching and Referral? We are really pleading. I have a patient here, and no one is attending to that patient. So we are really crying. We are telling the government, we are telling the county government to just come to this place and save the situation. Thank you very much.
Thank you very much. That's he has a patient inside there, and he said the situation is dire. This comes as the government and the Kenya National Union of Nurses plus the KMBDU are really in wrangles to make sure just the hospital or this CBA that's around the entire saga of the hospital gets well according to some of the stakeholders who have managed to speak to earlier.
Well, many thanks there, Elvis Koskei, speaking to us from Eldoret and just giving us a sense of what's happening on the ground in regard to this ongoing strike. And let's move our attention now to Nakuru. And now we are informed that patients have been locked up at a Molo Sub-County Hospital, even though there is no one to attend to them. Some families are now seeking assistance to remove their patients from the hospital. Our reporter Victor Gale now joins us, and many thanks, Victor. Just paint for us a picture of what's happening in Nakuru County.
Well, a spot check in most of the health facilities in the sub-counties, various sub-counties in Nakuru County. We've gone to Subukia, we've gone to Bahati, we've gone to Gilgil, Naivasha, Njoro, and Molo. The situation is the same. No patients are being allowed. Some of the hospitals that we've gone to, actually, you cannot access past the main gate. It has been locked by the guards manning the gate. And the few that we have gone there, like Njoro, Molo, and Gilgil, there are a few patients that are in the wards and have been locked up. Others were complaining, they were saying that they've not